Hello, this is Anne DeGheest, and this is April the 2nd. This is my clinical insight video. So in the first video, please take a look on YouTube. I'm going to talk about the fact there is a third wave going back up, unfortunately led by Europe and India. Unfortunately, the US is also bouncing back up by a good 20%. So we really need people to be careful. The good news, and you're going to see, we'll spend some time on that, is that we're doing an incredible job on vaccination. 30% of Americans have at least got one dose. And that's going to be critical because I'm going to talk about what's going on with the variants, which unfortunately are spreading through the US and they're much more contagious. Lots of information on long COVID. Remember, you may still get infected and get the long-term damage of long COVID there. So the issue we're going to find out is not mortality, is the chance of a 10 to 30% chance of getting long COVID is the real risk with this virus. And there's some vaccine update. So this is some really cool photography where you can see in blue is a cell, which is artificially colored. And in yellow are all these little SARS-CoV-2 that we really have been fighting for the last year. And you can see this is another one. This is this microelectronic technology that's so cool. So this is the nasty little animal there. Some news. The virus is infecting the saliva. And why is that important? Because we testing the nasal area there. That's what the PCR and a lot of the point of care testing are doing. And what they're discovering is that you may have no virus inside your nose, but you may still have it in your saliva and your mouth. So I'm repeating that slowly. That means you could still be infected and you could still be infectious, because what we are discovering, which I'll talk a little bit later, is that the salivary gland may be a reservoir of the virus. And so, and that explains why a lot of people are losing the sense of taste and smell, is because it's really attacking all these different parts of the mouth. So it's pretty much spreading everywhere in the mouth is what they are discovering. That just got published a week ago. So just a reminder, several people have called me about having some infection in the workplace. Remember, most people are infectious. Most of the infection is when people are pre-symptomatic or asymptomatic. And so just still, we're not out of the woods. If you have a vaccination there, we're going to talk about the mutations can decrease by 50% your protection. I repeat that. The mutations are spreading through the US can decrease your protection there. So you still need to be careful. And just a quick reminder there, this is when you get exposed, it can take up to 7 days to get the onset of symptoms. The PCR will not, if you've just been exposed, if you do a PCR, it will not probably detect you yet. It takes a certain amount of time to build enough of virus load. And the antigens are even more delayed. So be careful. If you get tested there, you may have a false negative and have a false sense of security there. So if you think you've been exposed, repeat the test or make sure you know the time at which you should be tested. So just refer to this graphic. So mutation there. Quick reminder of the alphabet soup of the mutation there. Remember, SARS has 30,000 letters of RNA, which are 4 blocks that are making the virus there. And these are these RNA that make proteins. They roughly have 29 proteins. So the mutation we're worried about is N501Y, and that means this asparagine, the amino acid asparagine, has been replaced by tyrosine on the 510 position. That's what these numbers mean. And the problem with this mutation there, this is the one that's both in the Brazilian mutation, which we know has really created havoc in Brazil, and the South African mutation. And it's also part of the B117, which is the dominant form. And this is the one that increased the infection rate by over 50%. The next mutation we worry about is the E484K. Again, it's that on that 484 position there, we have lysine that's basically replacing glutamate. And this is the one that is very dangerous, because this is the one that evades the antibodies and decreases the effectiveness of the vaccine created antibodies. This is the one that's unfortunately on the South African and the Brazilian one. As a result of that, the AstraZeneca vaccine is ineffective with the South African version. Sinovac also failed in Brazil. And the Lilly monoclonal antibody drug is ineffective in the hospital setting there. And we know that Pfizer and Moderna have dropped by 50% the effectiveness there. So this is a mutation there that we want to keep an eye on, because if it spreads in the US, it will decrease the effectiveness of the vaccine and you may still get infected. So unfortunately, we'll do less than 1% of the sequence in the US. So we're a bit blind. The US government is trying to ramp that up, but it's going to take a while before we match what the UK is doing, which is around 10 to 15% of all cases are being analyzed. So two variants of concern is the California B1427, B1429. The reason that it's a worry there is because it has also that antibody escape clause. And half the case in California right now have that mutation. So if you've been vaccinated in California, you still need to be careful there because that mutation is in the community there. And so there's a concern that you could get reinfected. There's a mutation in New York that's also worrisome, which may explain the surge we see in New York, New Jersey, and Connecticut there. And this is that famous variant I was telling you about, E484K. This is the one that is escaping the antibodies. And so please be very aware that these variants are moving in the US and are spreading. So to give you an idea, the B117, which is the UK mutation now, is 12,000 cases have been reported pretty much in every state. The good news on that B117 is that the vaccines are effective against that. So it's more infectious there, but you're being protected by the vaccine. The one we need to keep an eye on is this mutation from Brazil and South Africa there, which is still a small number of cases. But remember, we barely do 1% genomics of the cases. So this could be underrepresented by a huge factor. So vaccines versus variant, the new data just came out that the B117 is between 43 to 82% more transmissible and has been found in household pets, cats, and dogs. And that was the case when the owners were sick. So it was not the dog transmitting it, it's that they got it from the owners who were sick. And then it shows in the dog that they had this cardiac damage, which I took 2 weeks ago, that this virus is attacking the myocardium of the heart and is preventing impairment of the dogs and the animals. So it is validating that the virus during the acute phase is damaging the heart. The other data that came out in this paper there is that South African mutation increased the mortality by 20% and has 20 and basically completely escaped the antibodies of convalescent plasma. So there is no treatment in hospital that can help these people in South Africa there, and the AstraZeneca is ineffective there. So that South African version, we really need to keep it out of the US. This is the data if you really get an increase. I mean, they really did a lot of analysis there. You can see that the effectiveness of the vaccine are dropped significantly for both Pfizer and Moderna for these mutations there. So just be aware that the B117, it decreased some of the effectiveness, but you still have a lot of protection. But the one that are really worrisome is when it drops by 6 to 8 times. That means you don't really have too much protection. So if you have side effects when you get vaccine, that's good news. At least that's what my doctor told me, because that means you're making antibodies. So if you're on the call and you just got vaccinated and your arm's sore and you feel miserable, congratulations, you're making a lot of antibodies. Most common side effects is soreness of the arm, use an ice pack for 10 minutes. A redness, swelling of injection sites. If you really have a big rash, you may want to talk to your doctor and take some antihistamine. If the temperature, headache, and chills, you get Tylenol. These are the common ones. Very rarely do you have anaphylaxis shock. And in fact, the data has just come out. The probability is 0.0005%. And that typically happens in that first 30 minutes there where you're supposed to be observed. So you should probably not worry about it unless you have had a problem in the past and you need epinephrine. There has been no reported death after 150 million doses by the end of March. And everybody's different. You're going to find out that your spouse has no side effects and you're going to be sick like a dog. But you should expect the side effects for a couple of days. The second dose will give you a strong immune reaction and therefore a stronger side effects, but that means you need that to get longer lasting antibodies. You cannot skip the second dose for the mRNAs. So good news, in what's called real world evidence, which is what we really matter as opposed to clinical trials where everything is tightly controlled, Moderna and Pfizer have now shown that they decrease by 90% infection. So not only does it decrease by 95% your chance of basically getting the viruses, but it decreases your ability for you to be contagious and passing out to somebody else. So a lot of us were concerned that, we can maybe vaccinate and won't get a severe case, but can we still pass it on accidentally to somebody else? They say, yes, you could still have some virus, but the amount is very, very low. so that your ability to transmit this to a loved one is significantly lower there. And they did a study on around 4,000 healthcare professionals, and you can see after 14 days after the first dose, it decreased by 80% your contagious rate, and then by 90% after the second dose. So that's I think why you're seeing a slowdown versus Europe in the infection rate. The other great news is Pfizer has shown that their vaccine is effective for 12 to 15 years old, and there's no safety issues. So they're planning to submit to the FDA in the coming weeks, and probably is expected to probably be approved, in the next few months there. And so they're going to be probably starting the vaccination of that, middle school category there, before the school opens. They're starting the testing for children to 6 months to 11 years old, but that's not expected to be available until at least the end of the year. AstraZeneca is really having a bad time. They have now filed with the US with an efficacy of 76%. With 32,000 participants. The efficacy, interestingly enough, is higher for the older population at 85%. And what they're really pushing is the fact that they're 100% against hospitalization and death. So you may get sick, but you won't get very sick. However, there has been all this blood clot reported. And today, a person died in the Netherlands after having the vaccine. And so the Netherlands had put this on hold. Canada, a couple of days ago, also posed it for anybody below the age of 55 years old. So this blood clot seems to be happening with people who are younger, as opposed to the elderly there. The EMA, which is the FDA equivalent for Europe, has basically issued a statement there that the risk reward is still in benefit of continuing to do vaccination there. And then you may have seen in the press that there was a whole hoopla there between Dr. Fauci and the NIH about the data being reported there. So right now in the US, they're not approved, but they're kind of the leading vaccine in Europe. We have talked in the past about the vaccine breakthrough case. What that means is that you're vaccinated, but you get sick. You get sick and you may even end up in the hospital. What's the probability of that? So Washington State did a study showed that the probability is 0.01%. So that's even better than the 95% infection rate. So over 1.2 million people were vaccinated, which is around 16% of the state. And there were only 102 cases after 14 days that basically were reported with a PCR, and 8 got hospitalized. So still people may have end up in the hospital there, but the probability, as you can see, is very low. You still need to wear a mask and protect yourself because it's not 100%. So I just want to be aware, but the real evidence is showing the results are even stronger than in a controlled clinical trial. So there was a survey that just came out by the Oxfam International, 77 top epidemiologists in the world. And they asked them the question is that, are we, should we expect to get more vaccination? They do expect that in the next 12 months, 2/3 of them, there will be so many mutations there that they believe that the vaccine version we have right now will be ineffective. That these mutations we've been fighting, these E484K and maybe new ones, will decrease the effectiveness of the vaccine. So that in the next year, we're going to need another booster to basically boost up our antibodies, or at least have a slightly different type of vaccination for those mutations there. And so 88% felt that because we don't have vaccine coverage worldwide, it's giving a reservoir, especially the big worry is that the Southern Hemisphere right now is entering into their winter. And so they expect a lot of the mutation will come out of the Southern Hemisphere in the next couple of months while we're having our summers, and will come back and hunt us like it does for the flu for next winter. So that's the big worry there. So I was in some conferences there with Moderna and Pfizer CEO, and they're all working on this, developing a new cocktail of a vaccine that will not only cover the existing mutation, but also expected mutation statistically that could happen there, so that we get a cocktail to basically improve our protection there. But you should expect another shot before the end of the year. This is also some interesting news. It's called Somatic Hypermutation. This is a study that came out of Nature, and they look at survivors' antibodies and immune system in the blood. And what they discover is some really interesting things, which hopefully is good news, which is after 1 and 6 months, what happened is these neutralizing B cells mutate themselves. And what's happening is that instead of the body saying, well, I'm just going to get rid of anything that's not perfectly the B cells against that nasty virus that I had, it keeps them around. And it turns out this library of memory B cells, therefore, can attach to a mutated virus afterwards, if that makes any sense. And so when they basically start testing at 6 months, these people had been exposed to the normal Wuhan virus, which didn't have this two mutation we don't like there. They discovered that 30% of these memory B cells had mutated naturally inside the body, that they were able to attach to this new mutation that came up. Now, that doesn't mean that you may not get infected, but it means that you may have a lower severity cases because the body naturally evolved their own antibodies. The other great news, hopefully, is that they discovered that T cells, which is the second line of attack, the B cells is like a missile that's very targeted. It's very targeted to exactly that type of virus protein that you had the first time, or from the antibodies you developed from the vaccine. And then you have that second level of defense called the T cells. And the T cells seems to be also able to dampen the effectiveness of the new variants. And so that could basically allow us to decrease the risk of being a severe case, but also the infection and passing the virus. So if you look at the T cell, this is a picture of a T cell, is that there's a perception there that the antibodies that are still, the T cells are able to basically recognize some of this mutation and still respond to it, as opposed to the antibody, which is more single target. And so there's a perception based on the data that's been published there that the viral proteins are broadly expressed and the T cells react to a mutation, a broad spectrum of the mutation, as opposed to the single original protein that the antibodies were built for. And so it looks like these T cells we have right now are able to respond to these two nasty mutations we're concerned about, so that even if people may not have the original antibodies responding to that, the T cells may still provide some protection. The problem is that it's very hard for us to test for T cells. You don't have a diagnostic test like we have for antibodies. And so right now, so we believe that, you may still have some protection even if your antibodies start to go away after 5 to 6 months. I want to do a quick update on the post-COVID update, the post-COVID syndromes. We have been focusing over the last year on the mortality rate of 540,000 Americans, which we know is a tragedy there. And then we spent a lot of our efforts developing drugs and therapeutic for the hospital setting, which is around 4 million people end up in the hospital there. But we pretty much assumed that people were at home, which was mild to moderate, which was around 25 to 30 million cases reported there, is not something we should worry about. And unfortunately, we also know there's probably another 50 to 75 million people who were asymptomatic or were so mild they were never reported. And unfortunately, the data is coming more and more that the true problem with this disease is not going to be the mortality, is the fact 10 to 30% of people who have been infected, regardless of the severity of the symptom, including asymptomatic, develop over time, over several months, long-term damage to their organs. And that's regardless of age. And that could be between 8 to 22 million people in the US. They have reported between 100 to 200 different types of symptoms. And when you do imaging and severe diagnostic, it's pretty much every organ in the body: the heart, the lungs, the brain, the kidney, the pancreas, the liver. And therefore, it requires multi-specialists to basically be able to do the diagnosis and the treatment there. And these patients are very frustrated because they're not getting any help. So what's the mechanism? Why is this happening? We're not sure yet, but there's a couple of theories. One is that the coronavirus, it creates an autoimmune response. So the body defense system basically backfire and start attacking healthy tissue. So you have damage to the heart and the brain. A new theory has come out. Remember I was telling you about the saliva gland? Is that they're part of the bodies that are designed to not be responsive to the immune system there. And that's the brain, the saliva gland, and the eyes, and some reproductive organ. There's a belief there that this could be a reservoir of the virus that continuously simmers an infection, the chronic inflammation inside the body. And they believe that because if you give them a vaccine, it like flushes the system, and 30% of these patients suddenly feel significantly better, and all the brain fog suddenly goes away. And we knew that Zika and Ebola had that problem. They were hiding in certain part of the body, continuously releasing an infection there. And the third aspect was called the viral ghost. which is that there may be some proteins that are part of the virus that are still sitting in there, but the body is still responding to it. Although it's not the full-blown viruses, it's some part of the protein in there, and the immune system is still responding with the inflammation response and all of that has this long-term problem in several organs there. So, and this is coming from immunologists from Yale. One of you going to hear is what's called the brain fog, and they call this a cyclone of brain fogs. People literally lose up to 90% of their brain functions, memory, recall, executive functions, and all of that. And so the data is showing that 85% of non-hospitalized patients, this is from Northwestern University, had at least 4 neurological symptoms there. And it could be brain fog and fatigue with the number one. And then of course, dizziness and headaches and all of that. Half of these people didn't have a confirmed test because at the time they were asymptomatic or it was so hard to get a test. And 70% are female, and they have a very high ratio of autoimmune diseases, which is very similar to the male to female ratio. So there's clearly something going on with a trigger of autoimmune diseases. The average age is 43 years old. So these are not the old people that were on an incubator, on a ventilator. They were basically people who were basically at home. And there's a lot of research. This is a patient-led research collaboration, 3,700 people from 56 countries, showing that 85% had brain fog and cognitive dysfunction 7 months after the infection. And then another group called the survivor group, which survived 5,000 people, and half the people had difficulty in concentration and had long-term memory problem. Just to give you an idea, these are quotes from people there because it's hard to visualize this, but you can see these people are saying is that what they taste, for example, tastes terrible. It totally changed the taste of what you normally eat. You lose feelings in your arms and your limbs. You have tremors. You have fatigue. You're sensitive to noise. And you start having what's called tinnitus, which is basically a sound that goes into your ear. A lot of these people have insomnia. They have heart racing. They get confused. They don't recognize some of their loved ones. I mean, these are scary, scary symptoms there. It's not like a slight drop in executive function. Northwestern basically showed, you can see the statistics there. These are people who were not hospitalized, and most of them were not diagnosed with COVID there, that they have this really long list of neurological and non-neurological symptoms there. Brain fog and headache and numbness and tingling being the leading one, and shortness of breath. This is a study that just came out into international studies, and that identified 205 symptoms. And this is where it becomes really interesting. Some people are getting better over time. That's the good news. But there are certain type of symptoms that are getting worse over time. So let me kind of walk you through this. So they broke the patient population into 3 clusters. One cluster, which is, runny nose, sore throat, loss of appetite, got better over time, but then they leveled off and couldn't improve, and around 50%. And then there's another group there, which is the one that has cardiac problems that it gets worse over time. And we've had 2 cases I reported 2 weeks ago that in our group that were people, 2 young men in their mid-30s had massive heart attacks, and they had lost 75% of their cardiac functions. One had to have an implantable defibrillators, and the other one unfortunately did not make it. And you can see this is what we worry about, is that these cardiovascular are getting worse several months after it. And these patients had no idea. They had mild symptoms in November, and then suddenly had this first-time event, which unfortunately was traumatic there. So this is a hard picture to look at, but it's a heat map. And what you can see for certain cases, they are fine, and then they get, they start bad with fever and all of that, and that gets better over time. But then there are other symptoms, especially the cardiac one and neurological one, who are getting worse and worse and worse as the time spans. So they don't have too many symptoms the first few weeks, and then after month 7 they're having more symptoms. So it's clearly a progressive diseases that this virus is triggering inside your body. And at post-discharge, this paper just came out from BMG in the UK. And what it shows is that it took 48,000 people post-discharge. So it's a huge sample. And they matched these as a control. So there was another 48,000 people who were laterally healthy people who did not get infected. And what they show is that after 140 days, that 30% of the people had been readmitted and 10% of died after discharge. So these people have a progressive disease that continues to go after discharge. But more worrisome is that they had a 4 to 8 times higher rate of triggering diabetes, because it clearly attacks the pancreas, having a cardiac event, having these chronic diseases and of the kidneys and the liver. And to give you an idea, what they identified is a lot of these diseases are silent until you start having these major symptoms. Is that what they discover is that this thing after 4 months, when they do a scan of the whole body there, is that they're able to show that the pancreas is seriously damaged. I mean, people may not be aware of it, and it triggers type 1 and type 2 diabetes. Also, the cardiac myopathy that we took a lot the video 2 weeks ago. So if you haven't seen that video, please take a look at March 19 video there. And that's the area that has long-term consequences. So to give you an idea, in the body scan, what they discovered compared to the people who had recovered from COVID and the healthy control is the very high percent of the population there, close to 30%, had myocarditis, which is they had damage inside the heart. It's like congestive heart failure. So you have an enlargement and a damage of the heart, and that's non-reversible. It's that the heart, the kidneys, and the brain don't basically repair their cells when they get damaged. And so you can see there was hypertrophy of the heart, but clearly a myocarditis is an enlargement of the heart. You see a lot of people having pancreas. That's something that's really new. I hadn't heard that until now. And the liver. And there's a belief that there was a correlation with a high BMI and people having more severity. It may not be a BMI, it's the amount of fat in the liver that seems to be predictive of people having more severe cases and having long-term problems there. So clearly what we're discovering is 4 months after infection there, these people are getting worse. I don't want to scare you there. I just want you to be alert, because I think the true risk of this virus is not a mortality risk, it's for you to have this infection that can create long-term damage. So please stay positive, wear a mask, and get vaccinated. If you haven't seen my first video, please take a look, because I talk about the third wave in Europe, Brazil, and unfortunately it starts to emerge in the US. Stay safe, and see you in 2 weeks.